At Hill DT Solutions, we offer the why of decompression
and the how of decompression. It's a combination of two worldviews of how to integrate results-based decompression into your practice.
And the why as to why it fits perfectly in your practice, and the research of how decompression truly can benefit each one of your patients.
And the how is, how do you apply those techniques or protocols into your practice to actually help your patients? One of the big struggles that a lot of doctors find is that as they buy the equipment, they may understand what patients in their practice are good candidates for decompression, but maybe they don't have the tools and the skills for how to communicate that to the patient and get the patient buy-in so that they'll want to participate in the treatment program.
And often we hear doctors say to us, well, what do we need extra training for? Just tell us how to do the table and we'll start and do that. But really, decompression is a little different, and just as you have to get 30, 60, 40 continuing education hours all the time, you need to become a better physician and keep up with the technology and the systems that are being put in place every year. And Hill DT is a great place to get that training when you start with this new tool.
I think one of the very unique things about Hill DT Solutions is the fact that they've brought together a lot of different minds together in one setting to sort of create a protocol and a program that is duplicatable. It's not unique to, say, Dr. Reed or myself, but anyone can get involved in this treatment protocol and these therapies as they're done through the Hill decompression table, and apply that across the board to their community, to their unique patient practice setting.
And you're not alone. Once you go through the training, if you go through the training, you now have another resource person that can help you in your practice with those difficult patients that we all get every once in a while.
Dr. Reed, one of the questions that we quite often get from people that are looking at purchasing one of the Hill DT Solutions decompression table is, why would I need training on the how or the why? What makes this table so unique? Don't I just put the patient in the table and press the button and they get a treatment?
Well, I think once you recognize that all disc patients are disc patients, but they're all different. Every person is different, whether it's right, left, big, small, herniation, protrusion, extrusion, multi-level, single level, degenerative, facet, it just goes on and on and on. No patient is the same. And so the idea of training is to give you an idea and give you a resource so when it doesn't go right, that you know what to change to. That's just as important as setting someone up. As a physician, you have to know how to do these programs and systems. And so you have to be trained in that. You know, all of us are chiropractors. People say to us, oh, you know, I have my brother-in-law adjust me all the time. There's no training involved and the expertise is even lost. You need training. You can benefit from training, and you should get training.
The other thing that I think is unique about this is the fact that when you get the training and the education that we have as doctors of chiropractic, quite often you have a hard time relating or sort of getting in the patient's shoes where this is the first time they've ever even heard of a disc or herniated disc. These are all new terms to them. They have no idea what decompression therapy or treatment entails. And the longer that we do this as docs, we get very familiar with the terminology. It's hard to put our mindset into the mindset of the patient. So often we lose the patient, or the patient has a hard time connecting with the treatment that we're offering them. So one of the keys that we try to do with the how training is to sort of scroll back your thought processes so that you can actually put your mindset in the mindset of that patient who, even though you're an expert and you know all these things, they have no really idea what you're talking about, and thereby getting a much higher patient retention or patient follow-through because you've actually taken the time to meet them where they're at, explain to them, you need decompression, and here's why. You have one or three or all five of the reasons that we would do it, and then explaining to them the 5 components that make up a decompression treatment plan and why that's important that they need to do all 5 components.
I would hate to learn to drive a car at 16 years old without someone teaching me and helping with the experience. That's the same way this is. You're adding a new tool. Golfers get golf lessons. Drivers get driving lessons. Everyone needs help. We all need continuing education. And believe me, I've learned when I've gone in to do training, I've learned from other doctors. I remember going into Tim's office and helping him with his practice, and I'm telling you, I learned so much about how to handle a decompression patient from Tim. It revolutionized my practice. So we can all learn, and we can't let that dogma that we're the smartest guy in the room get in our way of helping our patients.
And I think all of us want to be better doctors, better physicians, better at what we do. And part of what Hill DT Solutions really does is keep it fresh. We keep it fresh by looking at the latest research, by a lot of Dr. Reed's training and expertise that he brings to the table as sort of a nationally recognized speaker on decompression, more or less an authority that we all look up to. And as we bring together all these great minds and great practice experiences, it's like having this giant textbook that you can open up and you can refer back to, especially with the difficult to treat patients that may really challenge you, and you have this new piece of equipment that you're all excited about using, but maybe you're not quite sure how to start out. One of the questions that we'll ask you when we start at the beginning of the how and the why training from Hill DT Solutions is, now you've purchased a decompression table, now what? Well, that is the component that we try to give you, is how do you identify the decompression patients in your practice? You might already be seeing a large number of patients that would benefit from the decompression treatment. It's not like you sort of got to recreate a new practice. You've already got new patients coming in. You have reactivated patients. You have current patients that you're treating that maybe you're not getting the results that you would like to get. And so what the training does is it helps you identify those patients. How do you communicate to the patient that they're a candidate? It's through the examination, it's through the testing, it's through the trial visit. We offer a trial to the patient to sort of test drive the system and the table so that they know what to expect through the treatment. And then finally, how do you communicate to the patient so that they understand why they need to pay you for these services and the value that you bring to them through these services that you're offering through decompression?
Yeah, I think the how part is one of the most difficult parts. You can try to figure out, well, it's going to be an investment, it's going to be this, it's going to be that, and is it going to be worthwhile? Well, your patient results are going to be there, but you've got to have systems so from the very beginning you don't make the mistakes that we all made when we started that. And through DT Solutions, Hill DT Solutions, you get this great cookbook pattern of the how part, of how to integrate, and so it fits right into the systems that you're already using. It's not anything new that you're going to do, it's how you work that in with your philosophy and your practice.
Yeah, and I think the key is keeping it simple. It's simply taking those next few extra steps so that you can integrate decompression into your already successful practice. Most doctors, I think, want to do the best possible thing for their patients, and adding another tool is exactly what you need to do to take your practice to that next level. And there's obviously rewards for that. There's the satisfaction that you have of getting patients better, getting them back to sort of their pre-injury or their pre-pain life of activities. And also, it's the fact that there's a nice revenue stream that comes in to the doctor himself who's doing the decompression. Most decompressions in most practice settings is a cash business. And when you look at today in the world of healthcare and how insurance companies are looking at what they're cutting back, what they're going to pay, increasing copays, increasing deductibles, it's getting harder and harder to have a better bottom line in the healthcare world. Well, what's great about Hill DT Solutions is that we show you how to take a decompression practice and incorporate it into your regular practice so that it's integrative, not only to get results for the patient, but to get results for your practice in terms of having a better cash flow.
Yeah, most people, most patients will spend an amount of money if they can see the benefit and how it's going to change their life. If they can buy in to the benefit that they're going to be purchasing by buying decompression from you, and they see that benefit and feel that and see how it changes their life, they will spend the money that you're going to charge. That's where Tim taught me how that was done when I visited his practice. And that's how Hill DT Solutions does the how part of their training.
Yeah, the really great thing is you're moving the patient from looking at buying a treatment per se or a program, but you're showing them how they can purchase a result. And the only way that I think that that's a true ethical thing is to sell them the result that they're going to expect is by actually being able to provide those results. And the reason that we're so confident that that can be is because of great people like Dr. Reed who put together this great why program, and Hill DT Solutions coming along and offering the how-to so that those two components together allow you to provide those results for your patients.